Welcome to FUNC YOU UP, the podcast that gives you the best of functional medicine, nutrition, and wellness in 8 minutes or less.
Hello, everyone, and welcome to FUNC YOU UP. This is Michelle Miller, clinical nutritionist.
And this is Diana Orchant, functional medicine registered dietitian.
Today, we have one of my colleagues and really fantastic guest to have on our podcast. We've been looking to do this for a really long time. We have Tanuj Palvia, who is a doctor of interventional orthopedics. And we have some really cool, really going into the functional medicine world today, some really cool topics to discuss. Dr. Palvia, start us out just what your background is, getting into interventional orthopedics, what that means. And so we'll kind of take the discussion from there.
Sure, I would love to. First, I want to start out by thanking you, Michelle and Diana, for having me on your program. I'm a big fan. I'm a weekly listener. So I'm really excited to finally make it on here. I feel like I'm moving up. So thank you very much for that. So yes, my name is Dr. Palvia. I'm an interventional pain specialist, which is basically a fancy title for I treat different types of pain here at Physio Logic. And before I get into that, yes, to answer your question about my background. So I'm a product of traditional allopathic medicine. I went to medical school at University of North Carolina. I finished what feels like a long time ago now. And then my additional training after that, as we do in allopathics, was in anesthesiology. So I first started out as an anesthesiologist and I trained at NYU. I did that for 4 years. And then after I did that, my interest started to sort of evolve. And, even though I like treating pain, most of my patients were asleep. So that sort of translated into how can I treat pain in patients who are awake and also those who deal with pain chronically. So I went on to do further subspecialty training in interventional pain medicine. So that's sort of how I got into this. That was a 1-year fellowship also at NYU. And after I finished that, that's when I really went into practice in treating different types of painful conditions. So I started out just treating kind of traditional sorts of pain, back pain, spine pain. But I felt that constantly when I was treating these kinds of things, I found that there was in a certain population, there'd be a recurrence. And that's when I really started to understand what chronic pain is and how it presents and how patients have to live with it and what the kinds of things that they deal with. And so I found sort of a growing, not dissatisfaction, but a bit of frustration in finding long-term benefit with treating patients who deal with chronic pain. And as my interests continued to evolve, that's when I got involved in regenerative medicine. And that's sort of where my main focus has been in the last 3 to 4 years, is that what can we do? How can we harness the body's energy to rebuild itself? And I'm sure we're going to get into this, but the body's constantly repairing itself. That's a remarkable thing. That's how we're able to live so long. That's how we're able to bounce back from injury. But sometimes, especially in the field of orthopedics, we have to sort of help patients along to get out of that funk that they may be in that's preventing them from getting that maximum benefit. And so just sort of at a very generalized term, that's how I got into regenerative medicine. That's where my interests are currently, because that's where I'm seeing the most success with treating with chronic conditions.
I just want to say, I think you work really hard to get through med school. You do all your fellowships, you do all your training, and I think it could be, enough just to kind of practice what you know at that point. And one of the things that I've always admired and really applaud with you is you're really curious and you're hungry to really help people. And it's so, I know all doctors, that's why they get into the profession, but it's very refreshing that you're always looking for the newest technology, the newest research. You're really innovative in the way that you provide your care, which I think leads us into what we now know of in our practice as regenerative medicine. So if you can kind of give us an overview for someone who's maybe never heard of regenerative medicine, what that means, especially because now you've talked about people with chronic pain, and I could list off 5 people that have back pain or knee pain or hip pain or things like that. I think probably everyone listening can connect to that too.
Yeah, absolutely. So regenerative medicine is kind of a buzzword these days. But it is, in truth, it is an ongoing, evolving field. It's a very new field. You have heard of things over the years, but to be honest, there's so much more to learn than we know already. And that kind of speaks to the point that you said before about constantly learning. I mean, part of being a physician is knowing what you know and also realizing what you don't know. And I think that's very important for physicians to understand that there's always going to be evolution and thought and information. And so being a student, I think, makes you a better doctor. So that's sort of my background on that. To answer your question, what is regenerative medicine? So in its most classic term, and it almost sounds like a dictionary, but it's very important to understand that regenerative medicine is a promising area of science that investigates the possibility of cell-based therapies to treat disease by repairing and then regenerating tissue. And that's a very important point, is that the tissues need to be repaired first before we can really go into regenerating. And I know, Michelle, you and I talk about this all the time, but there's a certain amount of correction that's involved in regenerative medicine. And I think that's an important point to address.
So yeah, I mean, there's many moving parts to this process. When someone has, chronic knee pain or chronic back pain, it's not just one injection, or it's not just, one thing, it's many pieces coming together. And the analogy we always use with our patients is, if your knee was a burning building, right? There's many floors. You have to there's a process that has to happen. You have to, clear out the fire and decrease the inflammation. You have to let the smoke clear out, start clearing out the debris, and then bring in the scaffolding, bring in the architects, and kind of rebuild from there. There are many, many steps along this way. It's not just one component that is kind of making this magic happen, this healing happening. It's many things coming together.
So Dr. Palvia, kind of walk us through this process and the various components of regenerative medicine and kind of what this framework actually looks like.
Michelle, to take your example as far as a burning building goes, if we were to compare that to an affected tissue, so for example, if someone has back pain, or let's start with the knee, it's a common condition we see. Someone who has ongoing knee issues, maybe has arthritis that's built up over years. Arthritis is an insidious process. And so you'll get a buildup of inflammation and chronic wear and tear to the joint that then results in a debilitating condition. And that happens from these sort of daily things in our life that led us to that point. For example, as I told you earlier, your body has a sort of regenerative capability on its own. And I usually like to explain to patients that's your equilibrium, that your body can handle a certain amount of insult and then basically bounce back. That's why when you get injured, in a couple days, you start feeling better because your body's able to repair that area. That's that body's, again, ability to balance itself out. What happens in chronic situations is that your body sort of veers off into this area where it can no longer correct itself or correct the injury. And that's when that fire starts, right? So what caused that? Sure, sometimes an injury can put you there, but again, sometimes it can just be this sort of chronic insidious process. So in regenerative medicine, our goal is to identify all those things that brought you over here and then start to try to unwind and unravel that so we can bring you here. We may not be able to make you brand new. Regenerative medicine is not just shooting some pixie dust into your knee and giving you a brand new joint. If someone tells you that, you should run the other way. That is not how regenerative medicine works. That is not how stem cells work. We are trying to unravel that stepwise damage that's occurred to that injured tissue over time. And that happens on a micro level and on a macro level. So when you come for your evaluation, the first day, just like any other doctor, the most important thing is we obtain your history and your physical exam and do any tests to really identify what is the damaged tissue, but then also what are the factors that got you there. So obviously, if there's some kind of trauma, that's the most obvious thing. If you, overdid it running, or over years you're a marathon runner and your knees have kind of been degenerating, fine. But what is the mechanics of your knee? Is it because you move? Is your hip off? You have a offset of your hip balance, which causes additional pressure on a knee. So there's some physical, mechanical components. There may be some cellular components. So for example, what kind of stress do you have in your life? All of your tissues are composed of cells, and these cells are individual units that need to function in an optimized sense in order to bring healing to that area. So if you have cells that are malfunctioning, for example, if you have, if you have some kind of endocrine imbalance or hormonal imbalance, or if there's problems with your hydration or your nutritional status, if you are have a diet where you're putting a lot of inflammatory type foods into your body, you're just creating stress on these cells. No matter what we do in order to try to regenerate areas, if we're regenerating, crassly put, if we're regenerating crappy cells, we're going to have a crappy outcome. So our goal on the very cellular level is to optimize attributes of each cell to identify the best that we can, and optimize those so that we can set ourselves up for the best possible outcome that there is. And so just like I described with the cellular level, which Michelle, that sort of is a nod to your area of expertise and how we work well together in optimizing patients, but then also from a mechanical level. So again, if I'm able to regenerate a tissue with whatever we put in there, if your body's not moving correctly, that tissue is going to get injured again. You're going to move back outside this area. So we also have to correct your movement. And so a lot of times what we do is prehabilitation. That's basically maybe some physical therapy or chiropractic care to really focus on how the muscles are moving, the tendons, joints, ligaments, how they're moving. What is the skeletal health, the symmetry? Those kinds of attributes are addressed way before we even initiate any kind of therapy. And so once we're finally able to get on that path and that sort of corrective path, and that's sort of what you were talking about, Michelle, is putting out that fire. For example, if there's a lot of inflammation there, maybe I have to treat that medically before we start to rebuild that tissue. That's when the conversation of regeneration comes up. How can we increase your performance from, maybe 50% recovery, make it 60%, 70%. And that's when we talk about things like stem cells or platelet-rich plasma. These are your body's innate cells that have the ability to differentiate into the cells that we are trying to populate into an injured tissue. And once we're able to accomplish that, we can put all those pieces together and really reap the benefits of this regenerative philosophy on treating orthopedic issues.
So this is also interesting. I mean, if you're a patient and you're deciding whether you should, go in with surgery versus go through with a regenerative medicine procedure, kind of how do you decide what's the difference between these?
Yeah, great question. So oftentimes in orthopedics, especially on our side, classically there's a very binary modality of thinking: surgery or not surgery. But I think it's better to address what are the goals. So goals always, especially, at Physio Logic, is better movement, better function, less pain. There's several ways to skin a cat, as the old saying goes. Sometimes surgery is the right answer. So I'm not against surgery whatsoever, but really what questions are you answering? In the same way that regenerative medicine is trying to heal that tissue, surgery is basically, like, for example, in a knee surgery, like knee replacement for end-stage arthritis, you're basically putting a brand new piece of hardware there. That is not necessarily the wrong answer. That might be the right answer. However, what are our goals? What are we treating? If you are someone who's having knee issues because the mechanics of your body is such that you're not moving properly, you're not walking properly, just if I put a brand new knee in there, so to speak, if the movement is still affected, if your mechanics, if your overall lifestyle is not corrected, then that knee replacement is going to still cause you problems over time because those underlying issues haven't been addressed. In those cases, I would say surgery would not be efficacious. And the same answer goes for regenerative therapy. The advantage of regenerative therapy is it is a much less invasive approach to trying to correct some of these underlying issues. It's all about addressing those underlying issues. And so to anyone listening out there, I tell them, whether you're considering stem cell therapy for a knee problem or any problem, or if you're considering surgery, it is very, very hyper important to understand that you and your treating provider understand and identify what are those goals that you're trying to treat, what are the underlying issues, and will they be corrected by the treatment path that you choose.
Yeah, I mean, surgery is like a mat. This should not be taken lightly. I mean, some people, I hear the complaints of, well, the regenerative process takes some time. I think I just want to like do the surgery and get over it. But the truth is like, that's not a guarantee that you're going to be healed anyway. So you're going to do this incredibly expensive, very invasive process. There's lots of risks with surgery. There's recovery time, and you can't even, guarantee. It's like, why exhaust your options before you get to that point if you can try something that's going to make your whole body healthier?
Yeah, I totally agree with that. I mean, you want to try to go for a least invasive path normally. And I have this very discussion with a lot of my patients who are considering surgery. A lot of times it's the right answer, but if it was always the right answer, I'd just tell you, go do surgery. I mean, I would just tell everyone to get surgery. it's very important to identify what that path is going to be and if it's going to give you the results that you're looking for.
So I'm big with kind of like analogies and metaphors, and I think of the regenerative patient, a lot of the patients we've worked with, it's kind of like a big puzzle, and all the pieces are different sizes. We worked with a patient together that was not sleeping. My role really became, how do I get this person sleeping? Because they are not going to be healing to their maximum capacity until they really start getting deep restorative sleep. But for other patients, my role might be working with, we always do comprehensive blood work with all of the patients that go through the regenerative process. Do any of them have really outstanding deficiencies? Do they have, diabetes? Do they have things that are going to slow down that healing process? One thing I can say, though, across the board we do is looking at an anti-inflammatory diet and lifestyle. And so, Diana, I just wanted you to touch on, I know we talk about this in a lot of our episodes, but just give kind of if this is the first time anyone's listened to us, I want them to have a brief summary of what an anti-inflammatory diet and lifestyle looks like.
So as an individual is going through any sort of healing process, we really want to just bring down inflammation overall, because that's a huge piece of this puzzle. And so what that really looks like is kind of crowding out some of the more inflammatory foods with wonderful sources of vegetables, fruits, healthy fats, high quality animal and plant proteins, and really kind of focusing on those areas, as well as healthy whole grains, and really eliminating more of the inflammatory components. So we talk a lot about these items, but they're gluten, dairy, soy, corn, alcohol, and refined sugar, because it's just going to really increase the inflammatory response in the body. And the whole point of this is to just kind of calm down that response, not say this is a permanent change, but just something that's going to really help those cells turn over and increase the healing properties.
Sometimes we have patients that come in and their diet is beautiful. They're already doing this, but like Dr. Palvia said, they have never learned how to move properly. So maybe they need to work with another specialist instead, and get some time with a good trained physical therapist and really learn how to move properly. But I think that's really the beauty of our integrated model with regenerative care. And I think, Dr. Palvia, if you just want to touch on like one of our recent stories together, kind of give us a little tease of like what this looked like on a very personal patient level.
Sure. We have a lot of them, but the one that comes to mind that I would think has been one of our greatest success stories, just to kind of give you a two-liner, this is a patient who is probably in her early 70s, who's been dealing with chronic knee issues, bilateral knee issues, probably for 20 years, started to feel issues in the knees that were degenerative in nature when she was around in her mid-50s, and has kind of just been sort of doing a Band-Aid approach to her lifestyle to avoid the surgery that a lot of people with knee problems sort of view as an end-stage situation. So this was a patient that I saw. I've been seeing her for years. She basically has end-stage knee arthritis. Probably, her surgeons recommended to her many years before I even saw her that she's ready for a knee replacement. But obviously, that's a huge deal, and that's not something she wanted to do. So for the first year or two, I was sort of just treating her symptomatically, trying to get that inflammation down, either through systemic approaches, as Diana mentioned earlier, whether it was nutritional modification, but sort of not really a deep dive. And then, from some of the things that I do, medically speaking, to get that inflammation down, whether it was visco treatment, which is sort of just to give a little bit more padding in the joint, but not really give that regenerative benefit that can be very helpful. And so sort of to summarize, she had that approach over years, and then finally, about a year and a half ago, decided to give it a go on regenerative medicine. And again, sort of came in with that same approach. Okay, doc, let's shoot it and hopefully we'll get good results. And I had to explain to the patient that that's not, just as we've discussed here, that's not how it's going to work, is that there's going to be a huge commitment required on your part to really start reversing some of the things that have gotten you to this point over the last 15 years and probably beyond that. And I would like Michelle to chime in here, but before we even, she wound up doing stem cell treatment to spoil the story. But before she did that, she underwent a pretty prolonged functional medicine program / nutritional program. I don't want to give away your part, Michelle, but she's been one of our greatest success stories, and I think everyone out there should hear about this.
Yeah, and I also just want to say, I mean, Diana and I both worked with this patient, and she was committed to healing and committed to having a success story, and really was throwing in everything she had. And I think that's when we see the biggest biggest magnitude of healing happening. But yeah, I mean, by analyzing blood work and working with diet and lifestyle, she lost, I believe, at least 20 pounds before the procedure, which was great. And obviously takes a ton of inflammation and stress off of the body and the joints.
Yeah. And I don't want to, I'm sorry to interject, but I don't want to downplay that, because folks who are dealing with end-stage arthritis in a load-bearing joint, namely the knees and the hip, if you can even drop 5 pounds, I think it makes an amazing benefit in terms of improving your movement and decreasing inflammation. And the fact that you both were able to work with her and get 20 pounds off before I even approached her knees with any kind of treatment, she had a phenomenal level of improvement. And I think that can't be overstated.
Yeah. And, just the other things that, Diana and I normally do, just like Diana was mentioning, decreasing inflammation, making sure that the diet is rich with nutrient-dense foods, minimal processed foods that are kind of wasted ingredients, and just optimizing blood work, optimizing her vitamin D level, making sure that she's utilizing a lot of good anti-inflammatory herbs and spices in her diet. Getting good restorative sleep. She has a great gratitude practice, and that I really think was part of her healing journey as well. But yeah, I mean, I think there's so many steps along the way of just she's healthier, body, spirit, and mind, and I think that's really awesome about our integrated process, is that so many things healed along the way, but she wouldn't have had the magnitude of healing in her knee if everything else wasn't healing at the same time.
Absolutely, 100%. The kind of recovery I've seen from this integrated model, this joint approach that we had, it just speaks volumes as to the potential of regenerative medicine. But it has to be a very systematic process, and there's a very high level of commitment to sort of unravel those injuries that have been accumulated over the years, either due to trauma or lifestyle, etc.
So Dr. Palvia, for anyone listening that might have knee pain, back pain, shoulder pain, I guess what would be their next steps? What would you recommend?
Right. Well, I answer this question in the talks that I give and so forth. I think the biggest, most important question here is if you're looking to do something about your chronic, especially orthopedic condition, that's the scope of our discussion today. For a chronic orthopedic condition, there's a couple things that you need to consider. First of all, it's good to be in the hands of hands of a good team, not necessarily us, although I do think we're pretty good at what we do. But whoever is guiding you is really able to understand what your goals are. The goal, and again, knee is just such an easy example. But for example, if someone out there is dealing with a chronic knee issue, what are our goals? Do you want to walk rather than 1 block before getting tired? Do you want to walk 5 blocks, or do you want to walk 8 blocks? Do you want to be able to, if you have back pain, or bend over and pick up your grandkids, or, go an extra mile or run a marathon, whatever the goals are. I think it's very important to identify those, because that's it. In the end, achieving those goals should be the entire purpose of what is undertaken. And so I think that's the first part. The second part is, as you're reviewing your options, to see if those goals can be addressed by that option. So, I've been full of old cliches in this discussion, but if you give someone a hammer, he's going to look for a nail. So if you go to a surgeon, he's going to say, yeah, I can give you a knee replacement and X, Y, Z, etc. If you go to a regenerative medicine specialist, he may give you some kind of advice that he thinks is the best, but ultimately you want to marry that advice with what your goals are. With respect to regenerative medicine, if that's something that you're considering as an option for you, a lot of it is going to be dependent on your evaluation. So who is a good candidate for regenerative medicine is entirely dependent on the evaluation. There is not a one-size-fits-all solution. There's not we're just going to inject you and we're going to be fine. None of that is really any practical form of advice. It's that one-on-one consultation with the provider that really starts to, that is useful in addressing some of those goals and see if they're achievable. And then, of course, it also comes from you. A very motivated person is required, because it is not, as I've stated many times now, it's not a simple journey. There are a lot of steps often that have to be undertaken in order to gain those results that we're looking for, whether it's prehabilitation, if it's an adjustment in your movement, your lifestyle, your activities, your diet, your sleep, your stress levels, your hormonal imbalances, any endocrine any underlying medical issues. All of those things have to be corrected in order to get the best possible outcome. And that really goes for anything. It can be regenerative medicine, it can be surgery, it can be for taking a medication or a pill, whatever you do, and that sort of applies to all of those areas. And I think that's really the takeaway from this is in order to reach those goals, they have to be well identified, and they require that level of motivation that is necessary to accomplish them.
Well, thank you, Dr. Palvia, for joining us today. I think you've really armed our listeners with a variety of options and different integrative therapies to consider on their journey. So if anybody listening has any questions, we would love to hear from you. You can reach us via our Instagram at Physio Logic NYC, or via email at funkyouup@physiologicnyc. And Dr. Palvia, where can listeners reach you?
Sure, I'm available across all platforms. You can email me at drpalvia, Palvia, @physiologicnyc.com. You can also follow me on social media. My handle is PalviaMD, PalviaMD. I have an Instagram account and a YouTube account, so always posting fun and educational stuff there. And that's pretty much it.
Wonderful. Well, thank you so much for your time today. Thank you so much for your energy and your expertise. And again, I think every individual wants to be seen by a doctor who's going to personalize and customize their care. And that, to me, is the true beauty of integrated medicine. So I thank you for what you do. I so appreciate working with you. And I'm excited to heal more people out there.
Yeah, thank you so much for having me. It was a real pleasure.
All right, we'll catch you on our next episode of Funk You Up. Like Diana said, you can like and subscribe. Please share this episode with anyone you think could value from hearing this information, and we'll see you next time.
You've been listening to Funk You Up. Be sure to like, review, and subscribe for more daily tips on living well.